Hi everybody, Dr. Hilinski from San Diego, California. Let's talk about how much does a centimeter matter when it comes to the size of the ear. The majority of the patients that I see for macrotia ear reduction surgery have an ear that ranges from 6 to 7.5 centimeters in size. We use the metric system to measure, where 1 centimeter is equal to 10 millimeters. And most of the patients fall typically within this range. Have I operated on patients that have much larger ears than this? Absolutely. But a majority of the patients that I see typically fall within this range. So let's use this as sort of a standard. When we're measuring an ear, we're looking essentially from the top of the helical rim down to the bottom of the earlobe, and we're measuring at a slight angle because the ear doesn't sit vertically on the side of the head. So let's say I take 1 centimeter off the top of the ear. Keep in mind, this doesn't include those patients that we're performing earlobe reduction on. But let's say we take 1 centimeter off the top of the ear at the scapha area. How much of an impact does this have? Well, it actually has a significant impact. There are patients out there wondering, does 1 centimeter even matter? Is that a significant amount? But 1 centimeter in the world of cosmetic ear reduction is significant. If you think about it, let's say we start off with an ear that's about 7 centimeters in height, and I take away 1 centimeter. That translates into about a 14% reduction in the overall size of that ear. That's pretty significant. If I took somebody who was 6 foot tall and I took away 14% of their height, that person would end up being much, much shorter. If I took away 14% of the size of your nose, that would be significant. So if you really think about it, that's a pretty big impact on the size of the ear. And that's only considering the one dimension from top to bottom. You have to keep in mind that macrotia ear reduction also results in the ear being narrowed at the top because I'm removing a significant portion of that scapha and recreating a natural curvature. So it's not always about just this one dimension, but I just wanted to emphasize the fact that even 1 centimeter in most patients is going to make a real impact in terms of how you look. I hope this discussion helps and look forward to seeing you folks online for future discussions.